Yeah, I know. Hi, good evening, everyone. And by the time we are just waiting for people to join in, I am Dr. Shivam Shingla. I am a medical oncologist, and we work at Surya Hospital to give chemotherapy care for the patients, cancer patients. So I think it's a good opportunity for all of us to come together and help create a cancer awareness outcome for the patients. Now, how cancer care is changing, it's an ever-going discussion, and we are really seeing on a day-to-day basis that how cancer patients are getting more care now and what's happening with cancer care. So I get asked a lot of questions from people that what are the different ways of diagnosing cancer and why is cancer increasing. So I thought that we keep a Facebook chat, live chat, so that to identify, why the cancer is increasing and how we can fight cancer. So it's interesting to know that in US, United States of America, the chances of getting cancer is up to 41% in the lifetime. And that's a huge number. So every 4 out of 10 people will get cancer in United States of America. And there are various factors why cancer is happening at a higher percentage there. One of the reason is to do with the body mass index, which is quite high in United States, and obesity, according to the World Health Organization, is the uh, main reason for developing cancer. In India, there is no consensus on what percentage of patients will develop cancer so far in their lifetime, but we've seen our numbers are persistently higher than that of American society, and majority of it is because of tobacco consumption. So we may be sitting at a lifetime risk of up to 50 to 55% to develop cancer if we were to go ahead and live a normal lifespan. Now, people do ask me how to prevent this, and I think Meghna has asked very rightfully that what are the pros and cons of cancer screening. For that, we have to understand that what is cancer screening. So basically, cancer screening means that you have to catch cancer in an early stage. So every cancer goes through different stages. You have stage one, stage two, stage three, and stage four. And before stage one, also you have a pre-cancerous stage that we call as PIS or cancer in situ. Now, the aim of cancer screening is to identify a population which is at risk of developing a cancer and to identify cancer in a primitive stage. We believe that if we screen women above 40 years for breast cancer, 40 to 45 years of breast cancer, we can prevent women from breast cancer related death in approximately 4 women out of 100. So, breast cancer screening can be detect early cancer in these 4 women and they can undergo surgery and prevent even from getting chemotherapy. So that's a very good pro of doing cancer screening. What are the cons of doing cancer screening? One of the biggest con of doing cancer screening is that people get a false belief that they don't have cancer now and they go on and start living an excessive lifestyle. So I've seen that people who are smokers, they come to me and they would want a cancer screening to be done. They do a cancer screening and then they will say there's no cancer and they'll go back to smoking. So this is one of the cons of doing a cancer screening. The other cons of cancer screening is that people sometimes don't understand the exact benefit or the meaning of a cancer screening. They just do it out of fear, and this leads to apprehension, anxiety, and none of the tests are perfect. I have a lot of people who are doing routine CEA levels for colon cancer, and eventually there is no cancer that they have. It's just that they have a higher CEA levels as compared to normal population. So they end up doing all these tests, which leads to a lot of apprehension. But in the outset, cancer screening, if utilized correctly, is beneficial for patients. Now, the other question people have asked is, what is the screening test for cancer? So basically, cancer screening is age dependent. It is also dependent upon your risk factors. For women who are above 40 years, we do a mammography to screen for breast cancer. Incidence of breast cancer is about 1 in 22 women in Bombay. So it's worth doing a mammography for women above 40 years. Uh, we also screen for cervical cancer in India, which is one of the most common cancers in India. And this is screened at the age of 27 by the help of a pap smear. So look at doing these two tests if you are a woman. For men, we do colon cancer screening and a prostate cancer screening. So a prostate cancer screening is a simple PSA test, which is done above the age of 50 years, and a colonoscopy, which is done above the age of 45 years. So these are the two tests for cancer screening. It has been said that if you were to follow these two tests, the cancer incidence or the mortality related to cancer would come down by half. Now, what do you think about US PSTF recommendations to effectively end cancer screening for prostate? I think this is a long-going debate, Divya, that there are a lot of people who are debating whether to do cancer screening or not for prostate cancer. There was a big trial which was in UK, which suggested that patients who are even with cancer of prostate can go ahead and lead a normal life. But when we are extrapolating this data to the Indian population, we are finding that Indian cancer patients with prostate cancer are coming up at early stages of life, and they have slightly aggressive cancers as compared to what is found in Europe and US. So I think we should continue to screen prostate cancer in the Indian settings until we find out, the exact implication. As of now, the Indian Oncology Society recommends cancer screening for prostate cancer above the age of 50 by a PSA test and a digital rectal examination. PSA is important, especially for patients who have a family history of cancer, in prostate cancer, breast cancer, or pancreatic cancer. Also, for patients who have urinary symptoms above the age of 65 years, I do recommend a yearly to 2 yearly PSA after the age of 50 to 55 years for all patients, because we are getting to see a lot of prostate cancers in Indian subpopulation, which is found at least a decade earlier than the other subpopulation. So another question which is important is Shampa Behra has asked is, are there any risks associated with cancer screening? Relatively, cancer screening is a safe process. The only risk is we don't understand the implications of cancer screening. None of the tests in oncology is 100%. So some patients may become apprehensive on elevated levels, which may be just the above standard normal. Colonoscopy can lead to sometimes pain, which may be prolonged, but I do recommend it for above people above 45 years of age and getting a stool blood test. Doing a cancer screening and preventing yourself from the risk of developing cancer in the future, and the fear of living with cancer related morbidity, I think the consensus is on cancer screening. So another question Shubham Tyagi has asked is, what is the sign and symptoms of pancreatic cancer? Pancreatic cancer is not a very common cancer, although most deadly one. So even if one of the relatives or the distant relatives who were to suffer from pancreatic cancer, we hear very bad news, and the patient dies very fast. So that is why a lot of people ask me this, that how to screen for pancreatic cancer. Well, actually, there is no general screening for pancreatic cancer. The symptoms and signs of pancreatic cancer with which the patient presents is, since it is very close to the backbone, these patients come up with back pain. Pancreas also is the passage for all the nerves to the GI tract. So these patients do complain of constipation. Pancreatic cancer patients do complain of weight loss. So back pain, weight loss, and constipation. If these three symptoms are there, then I think it would be worth looking at pancreatic cancer. There is no screening test for pancreatic cancer. Doing an ultrasound or a CT scan is of paramount importance. There is a test of tumor marker, we call it a CA19.9, which is a simple blood test which can be done to corroborate the clinical findings. So doing CA19.9 is a good option. Oral cancer screening is generally done for patients who have dental issues, tooth issues or patients who are tobacco consumers. So typically, a medical oncologist or a surgical oncologist would peep into the oral cavity with the help of a simple torch or a laryngoscopy, which is done indirectly through a scope, and this would show a ulcer or a white patch or a red patch. A red patch is known as erythroplakia. A white patch is known as leukoplakia. If you have an ulcer in the oral cavity which is not healing for more than a week, I think it's important for you to come forward and get yourself tested. Oral cancer occurs in majority of the patients who are tobacco chewers, so there is a very strong linear correlation between the amount of tobacco consumed versus the incidence of oral cancer. Uh, for all tobacco chewers, it's important to examine yourselves and with the help of a dentist or an oncologist from time to time basis and quit tobacco as early as possible. I don't foresee anyone in the world consuming tobacco and not developing cancer. Eventually, tobacco leads to 100% cancer occurrence. It may just be delayed with your body's ability to fight the cancer. So people who continue to chew tobacco will eventually develop cancer even at the age of 85, 90, 95 years, even if they stop consuming tobacco. It's just when their body's ability to, fight from cancer and damage caused by tobacco goes down, they develop cancer. So please, my simple advice is a lot of people come and say that they tobacco, a lot of their friends have been chewing and they have not developed cancer. In their family members, people are chewing tobacco and they have not developed cancer. I can tell you with certainty that tobacco will cause cancer 100%. There is no doubt about it. The next question is Suman has asked is what are the cervical cancer screening and prevention? Cervical cancer is again one of the most important cancers. We most common cancers. We have a vaccine for cervical cancer, which is known as HPV vaccine. It is available in easily available in all hospitals, including Surya. This is to be taken in two doses, either a month apart or in three doses at a month and a 6 month apart. This vaccine is to be administered from the age of 9 years onwards to 16 to 18 years, basically before the first sexual contact. First sexual contact is the time when women get infected with HPV virus, and this is carried by men to the woman. So, post marriage, the benefit of this vaccine is really not there. So, please consider vaccinating. In terms of screening, the cervical cancer screening should start at the age of 27 years, and this is an annual pap smear. Once your three pap smears are negative, and you are limiting yourself to a single sexual partner, then the chances of developing cervical cancer in the future is not there. So typically you start at 27 years of age, and we don't screen women above 65, 60 years of age for cervical cancer. It's a relatively cheaper test. 800 rupees is the cost of test. It's available in the hospital, so people are welcome to take care and be a part of this. What is the procedure of mammogram and breast cancer screening? Farul Batra, good question. So mammography and breast cancer screening to be initiated at the age of 35 to 40 years. Mammogram is to be done biannually in women, and it generally gives a reading of BIRADS. So BIRADS mean is if you have a BIRAD of 1 or 2, that means there is no concern for breast cancer. BIRADS 3 mandates repeating mammography at a regular interval, and BIRAD 4 or 5 indicates that people have very high risk of having a lesion in the breast which may be cancerous. So it's a simple test which may cost you about 1200 rupees to 1500 rupees, which is just an X-ray of the breast. You can also do an ultrasound of the breast to identify these lesions or an MRI of the breast, but mammography stands at the cheapest cost. We routinely do mammography up to the age of 75 years. After that, the breast is so easy and non-form that you can easily palpate the lump. So the role of mammography after the age of 75 diminishes, and that's this is the only test for breast cancer. Although I do recommend women to screen themselves for breast cancer by routine examination. So you can use the palm of your hand and you can evaluate the lumps starting from the inner quadrant, the outer quadrant on the left side, the lower quadrant, and the lower quadrant, inner quadrant of the left side and come back to the right side. Then palpate your axillas, palpate yourself in both positions, hands up, hands down, and this is generally recommended to be done at the time of taking a shower when you are more comfortable. Then, if you find any abnormal lump, please do get yourself examined. Women during the time of periods do complain of breast pain and lumpy feeling in the breast, but generally, if this feeling is bilateral, then very unlikely that this would be cancer. And this is what we call a cyclical mastalgia, when you get pain at the time of periods, and these are hormone driven pain. Nirmal Pradhan has asked us what is the line between normal cough and early stages of lung cancer. Lung cancer generally affects patients who are smokers, but now we are also finding that patients are developing a lot of lung cancers because of environmental pollution. Lung cancer is the single most cancer affecting maximum number of people globally, and in India you typically get 1,30,000 patients with lung cancer. So, lung cancer, the most common symptom is cough and weight loss. Typically, patients may have back pain when it spreads to the bones. There is no screening test, but we do recommend that patients who have smoked about 20 pack years, that means one pack per day for 20 years, should get themselves screened for lung cancer with a low dose CT scan. If the cough is persistent and your X-ray shows a shadow, then your pulmonologist should prompt you to get a HRCP done. What we have seen with COVID is that a lot of patients, the threshold for doing a CT scan of the chest has gone down. So a lot of patients have been detected with early stages of lung cancer. If your cough is persistent beyond 14 to 20 days and the pulmonologist feels that there is a shadow on the X-ray chest, then this should follow up with a lung cancer related screening if you are a heavy smoker or you have a family history of cancer. Ankita Sarkar Sonkar has asked, can life invasive screening eradicate cancer? There is nothing like lifelong life screening for cancer, but we can screen high risk patients and detect cancer in an early stage. Then the cancer remains curable in 100% of the patients if detected early. With our mammography screening campaigns, we save thousands of lives per month and lakhs of lives per year. These are the women who get screened for cancer. You have to continue cancer screening as specified by your oncologist. Uh, there are four major cancers which we screen for: breast cancer, cervical cancer, lung cancer, prostate cancer, and colon cancer. Four, five major cancers, they form the major burden. Most of the other cancers you cannot screen, but you can adopt a healthy lifestyle to prevent cancer. So, as the World Health Organization, and I would tell all my patients is that exercise during cancer treatment and in a normal individual can prevent the cancer from happening. It can also lead to better outcomes even if you develop cancer. Other thing is a good nutritious diet. This can significantly reduce the incidence of developing cancer. So instead of a screening for a lifetime, I would recommend a lifetime healthy lifestyle adaptation for fighting cancer. Breast cancer screening is effective. We can save a lot of lives, Deepa, by breast cancer screening. According to the European Society of Oncology, screening for breast cancer can prevent risk of death in four patients. So out of 100, if we detect cancer screening by breast, most of them would undergo treatment in early stage of the disease, but four lives will actually be saved. And this four lives is higher than the percentage of lives which can be saved through a vaccine of COVID. So yes, it's an effective process of preventing life. Prostate cancer screening, Rakesh Chandra Tiwari, I've already discussed. We do a PSA after the age of 50 to 55 years for men, and we routinely keep screening with PSA. Shivani Sharma has asked, I think we have discussed what are the advantages and disadvantages of screening cancer programs. Shivani, you can go back and see this podcast again. You'll be able to identify what are the advantages and disadvantages. Cost and benefit of breast cancer screening is huge, Shikha. The breast cancer treatment can vary from 5 lakh rupees to about 40 lakh rupees today. Even in a metastatic setting, the cost is innumerable. So, doing a breast cancer screening and detecting cancer in the early stage, the breast cancer screening may be for 1500 rupees. You can save tremendous amount of Delhi and a tremendous amount of financial resources that we imply to treat women with breast cancer. Prediction for prostate cancer using an MRI. We don't screen a prostate cancer with an MRI. We use MRI to, sort of solidify a diagnosis. So the process which goes forward is if we find a PSA more than 4 or 5 and a prostatic symptoms, the next step we answer is MRI. MRI of prostate is very specific test. The predictive positive predictive value is close to 90%. So patients who have a high PSA, the next logical test would be to do an MRI. MRI of prostate also guides us to which is the best place to biopsy the prostate from, and it's a very sensitive test. What is the potential of liquid biopsy in cancer screening and life expectancy? Sneha, not at all. We've tried that before. It's a nascent science. We don't understand the implications of liquid biopsy for cancer screening. I think we are still 5 years away from liquid biopsy being adopted. There are a lot of companies from time to time which come up with these, brilliant taglines that do a liquid biopsy and screen yourself for hundreds of cancers. But I am telling you, in reality, it does not happen. There is no role of liquid biopsy in screening cancers. This is all a sham. It will take at least 5 to 10 years before we start identifying cancer. At present, we use liquid biopsy to understand the dynamics of treatment in already established cancer patients. We also use liquid biopsy to screen the recurrence for these cancer patients. That's the only implication. Liquid biopsy is an expensive test. Also, to attain sort of excellence to report a liquid biopsy is very challenging, and it is something which is not at this moment available for cancer screening. And I don't foresee that this would happen in the next 5 to 8 years of life. So with this, I think there are no further questions that I can see. What I would utilize the last 4 5 minutes of my talk is to educate you about how to prevent cancer. Doing daily exercise is one of the most lethal tool against cancer, and it has been found that two major reasons for developing cancer, even in younger population today, is lack of exercise and depression. Whenever our body is going through depression, we don't realize that it is a state where we are sort of harming our own cells, and then these cells they accumulate mutations and they develop into cancer. Generally, in a healthy individual who's mentally fit and exercising, the development of these cancer cells they would be cleared up by the body's immune system, and that is what happens when we develop a bacterial infection or a viral infection. But persistent, it has been found that people who develop depression and who are not exercising and who are obese and who are eating very high calorie diet or infections, the body's ability to fight cancer goes down, and this is when they develop cancer faster. So if you were to draw two curves in the world today, the cancer incidence and the incidence of depression, both the curves are going parallel to each other. A lot of depression is common today. People get depressed even if you take the mobile phone away for half an hour from them or the internet drops. So my recommendation to audience would be to stop getting depressed, go out, exercise, and fight the way through cancer. When should we test for cancer? For women, cervical cancer age is 27 years, breast cancer age is 40 years. For men, colon cancer age is 45 years, and prostate cancer age is 55 to 60 years. These are the numbers that you need to remember. If you are a tobacco chewer, no age is right age. You can go ahead and see your oncologist today. If you feel a lump, you don't need a screening, you need to go ahead and see your oncologist today. All women in reproductive age group should palpate their breast for evaluation of breast cancer as and when we can. So with this, I would like to thank Surya Hospital and a fantastic team which is led by Vinita and other doctors here who helped me discharge my duties here. If there is anything you want to know about cancer, you can contact Vinita, who's our marketing head here for oncology services, and she can help you with my appointment or Dr. Rani's appointment as and when you need it. We are always available for your service. Thank you very much.